Syphilis is a serious health problem that many people don't know much about. It's a sexually transmitted infection, or STI, that can have very serious consequences if left untreated. Syphilis is a global issue affecting millions around the world. What makes syphilis so concerning is that it often doesn't show symptoms in its early stages. This means people can have it and spread it without even knowing. Syphilis matters because it's not a thing of the past. While treatable, it can cause long-term damage if ignored. Understanding syphilis, its history, and how it spreads is crucial to protecting ourselves and our communities. By raising awareness and promoting testing, we can combat this often silent epidemic. The good news is that syphilis is curable, especially when caught early. That's why it's important to talk openly about STIs like syphilis and encourage regular testing. Knowing your status is the first step to protecting yourself and others. The origins of syphilis are shrouded in mystery. Some believe it was brought back to Europe from the Americas by Christopher Columbus's crew in the late 15th century. Others argue it existed in Europe before that but was misidentified. Regardless, syphilis spread rapidly through Europe in the late 15th and 16th centuries, causing widespread fear and suffering. Early treatments for syphilis were often ineffective and dangerous. One common treatment involved mercury, which was toxic and had severe side effects. Another involved inducing fever, believing the high temperature would kill the disease. These methods highlight the desperation to find a cure and the lack of understanding surrounding the disease at the time. The discovery of penicillin in the 20th century revolutionized syphilis treatment. For the first time, there was an effective and relatively safe cure. However, syphilis remains a significant public health concern, particularly in areas with limited access to healthcare. Syphilis is caused by a bacterium called Treponema pallidum. This tiny organism is a spirochete, which means it has a spiral shape like a corkscrew. This unique shape allows it to move easily through bodily fluids and infect different organs. Treponema pallidum is primarily spread through direct contact with a syphilis sore, known as a chancre. These sores usually appear on the genitals, anus, or mouth. The bacteria can enter the body through tiny cuts or abrasions during sexual activity. It's important to note that syphilis can also be spread through other forms of close contact, such as kissing, if there are sores present. Pregnant women with syphilis can transmit the infection to their unborn babies, leading to congenital syphilis. This can have serious consequences for the baby, including developmental problems, deformities, and even death. It highlights the importance of prenatal care and testing for syphilis during pregnancy. Syphilis progresses through different stages, each with its own set of symptoms. The first stage is characterized by the appearance of a chancre, a painless sore that often goes unnoticed. If left untreated, syphilis enters the second stage, marked by a rash, fever, and swollen lymph nodes. These symptoms can be mild and easily mistaken for other conditions. The latent stage follows, where symptoms disappear, but the infection remains in the body. This stage can last for years, even decades. Without treatment, syphilis can progress to the tertiary stage, affecting the heart, brain, and other organs. This stage can be life-threatening and cause irreversible damage. Doctors diagnose syphilis through a simple blood test. This test detects antibodies, which are proteins produced by the body in response to infection. If the test is positive, further testing may be done to confirm the diagnosis and determine the stage of the infection. Early detection and treatment are crucial to prevent the serious complications associated with late-stage syphilis.